Hello friends, welcome to Retina Imaging channel. That was interesting case or twic. With this series we are going to present some interesting cases which we see in our day-to-day clinic. So the first case of this series is a case of macular neovascularization. This patient had received 6 intravitreal ranibizumab injections and the MNV is looking scarred here. However, if we look at the lesion carefully, then just superior to fovea, the area is little darker compared to the adjacent creamy colored scarred MNV. We have marked this area with the marker, and if we see the area by removing and putting the marker again and again, then we can see that this area is little reddish in color compared to the surrounding, and this area is reddish because it has some resolving subretinal hemorrhage which is still there, which is a sign of activity. Now SDOCT line scan of this patient showed that there was no intraretinal edema or there was no edema in the inner retinal layers. However, there was subretinal fluid which was a sign of activity. What interesting imaging feature which we saw in this patient in this eye was subretinal hyperreflective material or SHRM. Now what is this subretinal hyperreflective material? This is a homogeneous deposit located just above the RPE. We have marked this area with a yellow marker here. Another line scan shows the same subretinal hyperreflective material or SHRM. So this is how the SHRM looks. Now the most interesting thing which we saw in this OCT were the degenerative cysts. We can see that there are some cystic lesions near the fovea in this OCT scan which have been marked by the yellow arrows. So what are these degenerative cysts? These are not exudative cysts. They do not indicate intraretinal edema, but they are a result of degeneration or degenerative changes in the retina and underlying RPE. So these cysts are isolated, they are squared ones, they are smaller in size, and characteristic feature of these degenerative cysts is that at least one of the borders of the cyst is either concave or straight. So we can see that the larger cyst here has a straight border. Similarly, the smaller cyst also has little straight border towards the fovea. So these are degenerative cysts, and another important thing is that since these are degenerative, there has to be some RPE alteration or rather RPE degeneration beneath these cysts. So we can see that the RPE is not very well seen because of the degenerative changes in the RPE as well. So this is how we identify a degenerative cyst in a case of neovascular AMD. Another line scan also shows 3+1,4 degenerative cysts. If you look at them closely, they are again smaller in size, they have straight borders, and they have RPE alteration beneath them. Now what is important about this degenerative cyst is that the adjacent retinal layers just beside them look normal and do not have proportionate thickness compared to the degenerative cysts. So this is how we identify degenerative cysts. We need to remember that these cysts do not indicate an activity, or these are just a result of degeneration and they are not exudative or intraretinal fluids. So hope you like this video and you also like the concept of that was interesting case. We are happy to present you the first case of this series, and we look forward to have you again with our next video. Thank you very much.